All right, let's go ahead.
Please tell us your name and title.
Diana Lithgow. I'm a family nurse practitioner at the Laguna Beach Community Clinic.
And what is your relationship with COCC?
The consortia really banded together all of the ragtag little clinics in the early years and brought us to a situation where we work synergistically now rather than trying to solve problems all on our own. And I was a provider to the Cal Optima early years on their provider board, and that was all orchestrated through the consortium.
So how did you come to be involved with the consortium?
The director at that time of the clinic, the Laguna Beach Clinic, was also the director at the time, or the leader at that time of the consortia, and asked me if I would be on the provider panel, and so that really introduced me to the work that they did. I know we talked about it before that, but sometimes, when you're busy seeing patients, you lose your focus on the things that matter around you, and that really helped me know what they do.
Okay,
Too low?
no, that's fine, the audio's fine,
How about
but put the question into your answer,
Oh.
so that, because we're gonna actually cut her voice out.
Oh.
Okay, so from now, should we redo that and then?
No, that's fine, but, because some of
now
those are,
on.
yeah.
Okay,
All right.
okay, so first question. What are the unique challenges you face as a healthcare provider in getting patients to access healthcare in this region?
The unique challenges that any of the low-income clinics face to help get our patients the care they need is really the perception of the need for such a clinic and why is it even there. So to get past that, we need to show the good that we do and have examples of the patients that we've helped. And so in the consortia, that helps highlight that, and they have mechanisms to outreach as far as media, etc.
Can you talk about delivering high quality care to our patient population?
The care that we deliver in Laguna Beach Community Clinic and many of the other underserved, uninsured clinics in the coalition are basically the same as any care that is provided in any of the private offices. But the perception is that it's not. And I have to tell you, in the 2008 to 2010, with the economic downturn, when a lot of people lost their jobs, a lot of people showed up at our doors wide-eyed, surprised that they were at an uninsured, underserved clinic, and afterwards always leaving saying, "Thank you so much, you were so kind, so good, and I can't believe I'm getting all of this done, and I had put it off," etc. And everybody is really so good here. And I think that was really important for them to see that.
How do you collaborate and collectively work to ensure successful care?
Well, how do we collaborate is with the consortia is something that's very important, because if there are multiple unique problems to a clinic individually, and they're individually trying to solve them, that wastes time and energy and resources. So to be able to come together and pool for a solution, that's really what's very helpful about the coalition.
Hold on, I hear somebody talking.
They're out there. They're just standing there chit-chatting. It's that fella.
Joe?
It's Joe.
And it's actually distracting me a lot, and I've lost my place twice.
Joe, we can hear you on the camera. You go into the corner there. Okay. If you want to redo those questions again, we can.
I'm fine if you
Okay.
feel like they'll be able to use any of it.
Yeah, we could use it. It's
Was the
just,
audio fine? Like,
yeah,
did
the
you
audio's
hear
good. We
Joe?
just hear Joe. I mean, in the background, but obviously it's a business. You're gonna hear a little bit noise every once in a
Okay.
while.
Okay.
Okay.
Okay, next question. Name one example of an advocacy effort that succeeded and why.
So, an example that I can give of something that highlighted the strength of the coalition is I had a young woman who, she was a student at UCI at the time, and had a severe set of symptoms that no one was taking seriously. She had full insurance, she was a nurse working at the facility, and no one was taking her seriously. She had been a student of mine in the past, and she came to me here at the clinic and asked, would I be able to look into these issues? And of course, we found cancer. It's always the way. And the coalition was able to help rally behind me and some of the resources that we needed that dealt with her particular kinds of issues. And that was really powerful. And to this day, she comes every year. This was about 15 years ago. And she comes every year bringing a very big sheet cake for the clinic. And the front top of it, it says, "To my angels." And that's nice.
What would you consider to be the consortia's greatest strength and why?
The consortia's greatest strength is in having the diversity that it has. There are a huge number of different ethnicities, different strata in socioeconomic strata, and we have all kinds of people of influence in the coalition. So I think we have the representation that we need. We just really need the finances.
So going on behalf of that, what are the challenges posed by constantly having to advocate for funding despite consistently demonstrating value?
I'll tell you, the challenge is every single time every time I introduce myself as Laguna Beach Community Clinic nurse practitioner, and people say, "Community clinic in Laguna Beach? Do you want to stop?"
Yeah, is that phone in here?
Yeah, it's right there in that bag.
Oh, whose phone is that?
It's not mine.
It's not mine. Mine's on silent. I feel like it's an office phone or something.
Oh, it's an office phone, okay,
Yeah.
it's just coming up.
Oh,
It's loud.
sorry.
Oh, that must be inside
Yeah, I
the,
think it's the
Okay.
other side.
So I completely lost the question,
Okay,
so
let's
start
start
again.
on my question. Okay. So what are the challenges posed by constantly having to
Yes.
advocate for funding despite consistently demonstrating value?
The challenge that we experience having to advocate for ourselves as a low-income clinic, even though our product is of high quality, is that people don't seem to feel that there is a need in certain areas. Sure, they understand it if it's in inner city LA, but here, this is Laguna Beach. Why is there a community clinic? Why would there be a need for people who, for a clinic for people who have low income or uninsured? And it's just amazing to me that people feel that way or don't take the next step in their mind, that who's working in all those hotels and all of those restaurants and who's mowing all those lawns and who's doing all of the work. And so we have to get these people to understand that there is the need, even though it may not seem like it.
So how do you feel the community perceives your organization?
The community in Laguna Beach, it's actually the director has many times said it's the best kept little secret in Laguna Beach. Once people find out about it, we have a very active board who fundraises for us and tries really hard to get the word out. But the majority of the people aren't even aware that we're here.
So Diana, what is your job and why do you do what you do?
My job at the clinic is I am a nurse practitioner. I've been here 33 years. Sometimes full-time, sometimes part-time, supplementing. I also teach. I'm a professor, assistant dean. So I bring the education component to the clinic, and being at the clinic brings me better insight into the clinical role to my students. So we do precept students here, medical students, nurse practitioner students, and nursing students. So our role here is in education and in patient care.
Why is the work of the consortia so important?
The work of the consortia is very important so that we don't lose the shared collective knowledge. The collective knowledge is where we can save on resources and save on repeating mistakes in the past and having us all benefit for the solutions that come together.
Can you recall any special patient wins? If so, comment on them.
So I had a young child one time that, again, she'd seen her private practitioner several times, and she wasn't getting satisfaction with her little 6-year-old boy. He had peeling hands and feet, and that was it. No other symptoms. Once in a while, a fever for the last many weeks. I took a look at him, and something in my background clicked, and I was concerned. I called one of the pediatricians, and he said, well, you know, peeling hands and feet is a late sign of this particular disorder that I thought it was. And he said, but you can send him to ER to work it up if you really feel concerned. These people, the parents did not have a lot of money. They were afraid to go and incur a large bill. I took their phone number home, which I usually don't ever do, and just checked on him because I was worried. And sure enough, he had that very serious diagnosis, and he was in the hospital for several months. To this day, she comes and brings him. He has to see cardiology every 6 months and then every year for the first 2 years, and after that with primary. But she takes him and follows all their appointments, but she also brings him to see me. Those kinds of things make you feel really good that you caught something that others were missing because you listened.
Last question. What is unique about the community that you serve?
The community at Laguna Beach that I serve and that this clinic serves in the Laguna Beach Community Clinic does have a big disparity from the very wealthy to the very, very poor and homeless indeed. So it is very difficult to try to get everybody to know what the needs are and also then have the resources to be able to take care of the diversity that we have.
That's good. It's good.
Yay!